Here's a quick video on staining and glazing of OnX Tough 2. So first I'm preparing to get all my materials set up. I already have a pre-mixed pink resin that we use, of course, my tissue guide for colors. I get a couple of dips with the paintbrush just because I don't want to use too much. You can always do more, but you don't want to waste. Always keep it closed, don't want it subject to light and then it sets up and cures. Just getting all of the material off my brush so I don't waste any. I like 1 drop of red, just because I don't want the gums to look too red, and then about 3 drops of pink, which is the middle. I like to mix my pre-dipped, and of course I start with a very fine tip brush and work my way from the papilla all the way down. And I continue this on, just kind of going from papilla to papilla, because that's the most sensitive area, the hardest or tightest spots. And then eventually I'll use my purple light to just help it kind of tack cure so that those colors will kind of stay in that same spot and they won't start just moving around, especially as you're, moving the teeth. And there's the purple light that I use just to kind of help it stay. And then that also kind of initially sets up that first layer, so whenever you're going back, it actually starts creating a darker pink so you can get to a much prettier color based off of what your patient's gums are, or a natural nice coral pink. And of course, tack curing periodically, just really smart. It just allows you to get a better color, and again allows that, if you think about it, the color to kind of stay in that location and not pool in different areas or move or even get onto the teeth, which can then have some issues there. One tip I will mention at this point is that continuing to do this, of course, the slower that you go, the better the outcome is. Now, how I kind of imagine this, or the feel of this, is as if you're putting a pink color on top of a surface and you're kind of pushing it around until you get your desired color. And then here's, kind of everything done before I am going to cure it. Now, after the gums are done, I actually place it in for the entire cure. The one thing you need to know is that the more you cure these resins or these glazes, the darker they actually become. So I do not do any glaze on the teeth until the very end. So I do a full cure so that the actual teeth are done. Now I'm going back into some areas where I think need to be a little bit darker, because you can see, it looks like the teeth are coming through the gums. Don't really like that aesthetically. Patients also start questioning, it looks like they're having recession or something of that nature. We don't want that. So we just make sure we got some good coloration and continue to build. Also, this allows it to kind of have that natural distinction between tooth and gum. It makes it look really pretty. You can also see that I'm using cotton pliers in the actual access holes. That's really nice to kind of hold it so you're not touching it or putting your fingerprints all over your glazes. Not a lot of space to hold these things, especially when the entire thing's being done. As you can see here, I'm adding a little bit of red, just making it look like there's a little bit of vascularity in the area. Again, it's kind of like you're pushing color through water, I think is the best way to explain it. You're kind of maneuvering in, giving it that pretty little texture. Just double checking, seeing if there's anything I'd like to do, any other additional areas. The posteriors can't really see back there, but I like to make sure everything's covered. Now I'm cleaning my brush in alcohol, and I'm going to be placing a clear coat just kind of like you're doing your nail polish. Clear coat over the top of every single tooth. You can do this pretty quickly. I like to check and make sure that there's no areas missed, especially interproximally. I do a 30-second cure, and then I place it into a bowl of glycerin for a nice glossy finish. And that's it. You did it. Clean up your area. See you next time.